Hi, Lisbeth.
Hello, Ana
Hi,
Lucia, how are you?
fine, thank you. I have a question for you. Have you heard about acts of kindness during COVID-19 global health emergency?
Yes, many organizations, citizens, and activists call it makers in each country have called the maintain resilience against the COVID-19 pandemic.
Okay. Yeah, I heard that when the pandemic started, I heard about the maritime flights where they helped people to reach their homes due to the quarantine they had ordered. I really didn't do much. I was only able to support people who maybe didn't have a mask by giving them one. Um, well, and who needs or has mainly needed help due to the COVID-19 outbreak in our country or in the world?
I think of of the entry of goods such as food or medicine have caused serious problems for the population. um, for example, African countries such as Ethiopia or Nigeria, uh, which already have malnutrition problems, have needed more support to overcome the consequences of the COVID-19 pandemic.
Yeah, you have reason. In my opinion, I think it's the people who work every day, they were the most affected since there was no one on the streets and it was impossible for them to generate their income, no, because it's their work day by day by day.
Yes, for poor people, the pandemic was um, very bad.
Yeah,
for
very difficult.
yeah, okay, very difficult.
Okay, what kind of help has been offered during the pandemic?
Um, I think a kind gesture was the applause in several countries for the police, um, um, medical people, no, who sacrificate themselves during the first days of start the pandemic to save the life of the citizens. Um, other thing, I think countries like USA or Russia have been donating vaccines to countries like Peru, uh, um, because these countries doesn't have um, chances or purchasing vaccines. In Peru, I think um, uh, the COVAX facility program gives 2 million to of accounts vaccines. Sorry.
Okay, well, in Peru, I heard that the government offered the 600 pen or solace. Bonus for the most vulnerable families, no?
Yeah, the bonds.
Yeah. How people got involved or can still participate to help uh, to these people, no? Maybe donations, charities, volunteering.
Yeah, I think people, maybe active people, um, participate um, with donations, or they visit um, vulnerable, vulnerable places, um, to bring food or clothing or mask for people, for poor people.
Yeah, I agree with you. I also heard that some countries sent various molecular tests to perform on patients or send oxygen for the most critical people in this disease. If you have volunteered to help, or maybe would you be a volunteer to help? How and why? No, do you?
Yeah.
you
I never participate in volunteering, um, and because I am very nervous about load or some disease. But I could do something like visiting vulnerable places, no, or give some people donations, or medicine, maybe these, these things. And you?
Yeah, well, also like you, I haven't been a volunteer, but if I could do it right now, I could be with the topic of vaccines, helping people to do a good organization and understanding how important they are, you know?
Yes, yes, it's true.
Yeah. Well, Lisbeth, it was a pleasure to talk to you. See you next week or another day.
Okay,
Bye.
thanks, Ana Lucia. Bye bye.